Hello, Dr. Brant Hulsebus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do when someone has a question about chiropractic or chiropractic care. I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford Ice Hogs. Let's dive into it. Thanks for tuning in again. Today I want to talk about something that a lot of patients come in and tell me they're dealing with. And they're simply told they have a pinched nerve. They went to some other healthcare provider. The healthcare provider did a test, maybe some imaging, who knows. And they came with the diagnosis, you have a pinched nerve. Now, if you have a pinched nerve, is that something a chiropractor can work with? Absolutely. Every day, all day long, that's all we do. Let's talk a little bit about what a pinched nerve is and what a pinched nerve isn't, and a little bit maybe about how a chiropractor would go about taking care of it and what you should expect if you have a pinched nerve with the chiropractor, how they will go about helping you get over this pinched nerve. Number one, what is a pinched nerve? A lot of people use this term to describe pain or numbness or tingling going down the arm or the leg, or maybe even just like pinching going on in your neck or your shoulder area. And just so you know, this is actually not a pinching, because if it was pinched, the nerve wouldn't work. Your arm wouldn't go up and down. You wouldn't have anything going down your arm. You would have an arm that doesn't work. It's basically a nerve that's irritated, inflamed, or just has a lot of pressure going on from inflammation, swelling, or maybe a tight muscle, rubbing it wrong, different areas. I know one thing, like in the neck, when your neck posture is bad, there's a muscle that goes from your jaw down to your shoulder, and this muscle gets inflamed. When it gets inflamed, it gets sticky. When it gets sticky, the nerve can hit it, and then that will go down that nerve, doing what a lot of physicians refer to as a pinched nerve, when actually it's a posture and a chiropractic issue that we can take care of. Speaking of that, what is the most common cause of a pinched nerve? It's called a subluxation. And what's a subluxation? One or two more vertebrae in your spine are misaligned. This misalignment will cause them not to function the way they properly are. They will actually freeze, and the body will try to protect them from moving certain directions, from creating further injury. Now, when this happens, there's a chemical release called catecholamines. These catecholamines will hit the nerve, go down the nerve, and tell the nerve that now we're in a state of fight and flight, or change the autonomic tone of the nerve. Autonomic tone, what is that? The nerves are always working and functioning. You're not really thinking about it. It's part of our autonomic nervous system. And it's got two modes. Everything's good, or we're in danger. Maybe you've heard of fight and flight. So the nerve gets that fight and flight signal going down it long enough, and eventually it starts getting symptoms of a pinched nerve. So what chiropractors do is they take care of these subluxations. So in reality, if you have been diagnosed with a pinched nerve, chiropractors are excellent at finding the subluxation that could be causing the symptoms of what is referred to as a pinched nerve. Matter of fact, we're some of the best providers in the world to provide that information. So how do we do this? We have chiropractic examinations. So if you came to the chiropractor after being diagnosed with a pinched nerve, we would start off usually with images. We actually want to see how the spine lines up. If there's a misalignment in the spine, the easiest way to find it would be images of your spine. So we would take images. Now, if you've already had images taken from a different healthcare provider, please bring those with you. If you have those images with you, we might be able to use the images you already have. There's a couple of criteria. One, you have to be standing up. You cannot find a subluxation when you're laying down, because your center of gravity has changed how you're carrying yourself or holding yourself. Two, the x-rays have to be recent. They can't be from 4 years ago. We won't know how you got injured in a car accident 4 years ago with old x-rays, so they have to be recent x-rays. And lastly, these x-rays need to be of your spine. I've had people come in with x-rays of their foot telling me they got a pinched nerve in their back. Here's an x-ray of my foot. This will not help us analyze the spine. This will help you see the foot, but however, this will not help us analyze the spine. So please make sure that you bring one of the spine. The other thing we'll do is we'll go through a couple of range of motion tests with you. We'll see how you move or don't move. Remember, if these vertebrae are misaligned causing a subluxation, you'll have a lack of range of motion. You'll see a fixation. We also have several other chiropractic tests that we do, where we'll lay you face down, we'll bend your knees and lift your legs, have you turn your head, and we'll see how your spine moves biomechanically. If we see a fixation, that'll also help us match up with the x-rays and help us determine where this issue is so we can help relieve the pinched nerve, as so say pinched nerve. Now, if you went to a different doctor, you might have been prescribed things like muscle relaxers. Let me tell you why I personally don't care for muscle relaxers. I don't necessarily think that's always the best route to go. If you have a subluxation, the vertebrae are under stress, and they're trying to protect you from further injuries. So the muscles will lock up around there, not allowing you to twist and turn the wrong way to make the injury worse and create more inflammation. So taking the muscle relaxer allows that muscle to give up its guard, allows you to twist and turn the wrong direction, hence easily creating a bigger injury. So I'm not always a big fan of muscle relaxers. Now, I know some people take anti-inflammatories, and inflammation is a big part of this. So reducing inflammation is one thing, but I don't think muscle relaxers are always the way to go. But again, you shouldn't be diagnosing this yourself. You should talk to your chiropractor, and if you really want to get involved in a medical conversation, ask your medical doctor, because they're the ones that prescribe you the drugs. And I would ask them why a muscle relaxer without an anti-inflammatory if inflammation is the enemy. So once we have figured out what's going on with you, once we've figured out how you've already been treating it, then we can dive into a case. And what we would do is we would start by getting you a chiropractic adjustment. Now, there's all different types of chiropractic adjustments that different chiropractors do. If you've seen something that you're afraid of, if you've seen something that you're nervous about, discuss this with your chiropractor first. Us, we use our hands here in my office, and we go in there and use a noise that you hear, and that noise is simply gas being released from the joint. It is not ligaments popping or tendons snapping. In my clinic, we don't put straps on you and yank and pull on you. We are very specific. I would not get a chiropractic adjustment from anybody personally unless it was a very specific adjustment, unless they could tell me I'm adjusting this one vertebrae. When people do gross manipulations of the area, I don't really know if they're getting the right one or not. I also don't know if they're causing more problems. So me as a chiropractor, if I was a patient coming in for a pinched nerve, I'd say, what level are you adjusting me at, and how are you doing that to make sure you're very specific on that level? I would have no problems answering this question. I would actually love if somebody asked me this question, because I'd love to show you how I figured it out. And a chiropractor should have that attitude. If a chiropractor doesn't have that attitude, I would question the chiropractic clinic that I'm at. Now, how often do we have people come in for a subluxation creating a pinched nerve? That's all we do, all day long. That's people come in all the time with them. They come in and say, I got this feeling here. I feel like I can't turn my head here. I feel like I can't do this. I feel like this going down here. And we look at their spine and we find the subluxation. We do the vertebral correction through the chiropractic adjustment by using your hands. So this is a chiropractor's everyday practice. This is something that we do constantly. So how do you know when you should get checked? You could wait till you're feeling the pain, numbness, tingling, burning, weakness, or maybe a lightning bolt pain. But don't think it's going to go away on its own. It's not. Your spine's actually going to adapt to the injury, and this will become more of a chronic problem that can lead to accelerated degeneration on top of it. Now, when I say accelerated, I don't mean the next 6 months. I just mean in general accelerated. So as chiropractors, we want to see if you feel like you got a stiff neck, and then the next day you start feeling pain down your arm. If you were stuck in a weird position too long and now your legs are going numb. Let's say you're in a long car ride and now you have a little bit of lower back and now you're feeling you travel further down. These are all signs it's time to come in and get checked. Now, will you have another healthcare provider probably tell you to go to see a chiropractor? Probably not. This is why I made this podcast. The whole idea of this podcast is if you have a question about chiropractic or chiropractic care, the only person qualified to answer you would be a chiropractor. So if you were to ask your family physician, if you're an athletic trainer, your physical therapist, your strength coach, should I go see a chiropractor for this? They are uneducated on what chiropractors do. Now, there's always exceptions. My friends down the street from me at Movement Fitness, where I go work out every day, there's coaches over there, they would be more than happy to tell you to go see a chiropractor, because the majority of them have gotten to know me and understand what I do, and I get to show them people they work with and I work with, and we have a great relationship. So that time it's an exception, but for the most, really only person that can truly answer that question would be a chiropractor. So if you have a pinched nerve, I would tell you that 99 out of 100 times, chiropractic is probably the absolute correct answer as far as getting this looked at and getting it taken care of. It is basically what we do. It's how we started as a profession. Dr. Palmer from Palmer College of Chiropractic gave the first chiropractic adjustment to a pinched nerve that was creating hearing deficit. Dr. Palmer did the adjustment. The patient's hearing came back and chiropractic was born. So yes, you can definitely hear that. If you go to any chiropractor and ask them if they have any success stories dealing with a pinched nerve, they can probably pull out volumes of information of people they've helped with pinched nerve. You could probably sit in a waiting room in a chiropractic clinic and say, have you ever had a pinched nerve that the chiropractors help you with? And just the waiting room alone, people would tell you that's exactly what they came in for, and they got big help for it. So absolutely. Now, there are other things that we would do along the way besides just a chiropractic adjustment. That's going to depend on the individual. It's going to depend on your exam findings and stuff like that. What are some things you might expect? Maybe have you lay in a certain position to traction your back out to help decrease the odds of it going back after you leave the clinic. Perhaps using ice, perhaps using certain stretches, certain exercises, perhaps working with a physical therapist or a strength coach in order to rebuild the musculature around that's allowing you to get pinched in the first place. So there's more steps sometimes after getting your adjustment. Sometimes there's not. Sometimes you just get your adjustment and life goes on. What should you expect? How many adjustments to come in? Again, that's going to depend on your x-rays and your exam findings, but a chiropractor should be able to sit down with you and give you an estimated care plan of what they think it's going to take to get you better. A chiropractor that says just keep coming forever, that's when I would question. I want to know, okay, I came in for this, you saw this on your exam findings. As a chiropractor, what's your estimate of my care plan? The chiropractor should be able to answer that. Or maybe when there's going to be a re-examination or a redetermination if you need more or less care. That's things I would ask for too. So there you go. Does chiropractor help with a pinched nerve? Absolutely. Should you wait for a referral? No. Ask your chiropractor right away. Bring in your x-rays if you have them. Bring in your MRI studies if you have them. Bring in anything that you have with you to your appointment. Do not assume that the hospitals or the local healthcare clinics are linked to your chiropractic clinic. That is a very rare thing to have happen. Most healthcare systems do not link up with chiropractic clinics. You have to ask them why. It's not my choice, it's their choice. So make sure you bring your images and your x-rays with you, and then the chiropractor should be able to sit down and give you a consultation, discuss what they see in these, and tell you a ballpark of what they think it's going to take to get you better. If not, they should be able to start care with you, and after an adjustment or two, they should be able to tell you what they think it's going to take to get you better. I hope I answered the question about the pinched nerve. I know this was a topic I did a while back. Very popular topic. It's been a couple of years. I thought I'd revisit it again. So if you think you've had a pinched nerve, go see a chiropractor. Don't wait for a referral. Discuss the chiropractor what's going on, and the chiropractor should be able to help you. And remember, if you have a question about this or anything else that you might want to ask a chiropractor, this is why we have the podcast. Feel free to leave a message or comment wherever you're listening or watching this podcast, and we'll make sure that maybe next time you'll be the question of the week and ask the chiropractor. Thank you for tuning in.